In this video, we go talk about diagnosing narcissistic personality disorder. Diagnosing narcissistic personality disorder is very difficult. When someone really has a narcissistic personality disorder, they will not be diagnosed. They believe that everything is someone else's fault and never take responsibility for their own behavior. As a result, the diagnosis of narcissism cannot be made by treating physicians and remote diagnosis must be done. However, that's a big taboo in psychiatry. My name is Jacinta, the voice of Unmasking Narcissism TV. I'm an experienced expert and had a narcissistic partner in the past. How to diagnosing narcissistic personality disorder? Diagnosing narcissistic personality disorder takes place on the basis of a long questionnaire to which whether the patient meets at least 5 of the following 9 criteria from the Diagnostic and Statistical Manual of Mental Disorders, DSM. 1. Has a grandiose sense of self-importance. For example, exaggerates achievements and talents, expects to be recognized and superior without commensurate achievements. 2. Is preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love. 3. Believes that he or she is special and unique and can only be understood by or should associate with other special or high-status people or institutions. 4. Requires excessive admiration. 5. Has a sense of entitlement which results in unreasonable expectations of especially favorable treatments or automatic compliance with his or her expectations. 6. Is interpersonally exploitative, which takes advantage of others to achieve his or her own ends. 7. Lacks empathy, is unwilling to recognize or identify with the feelings and needs of others. 8. Is often envious of others or believes that others are envious of him or her. 9. Shows arrogant, haughty behaviors and attitudes. Diagnosing narcissistic personality disorder by a psychiatrist. Diagnosing narcissism can officially only be done by an authorized person such as a psychiatrist who has examined the person in question. The remote diagnosis of someone who is not your patient is against the professional code for psychiatrists. In some countries, this is even prohibited by law. The consequences of taboo and remote diagnosis. Herman has experienced a good example of the consequences of this taboo. Herman is the founder of this YouTube channel and the website unmaskingnarcissism.com. His narcissistic mother had driven his father into a mental institution. But the psychiatrists at the institution have repeatedly said things like, "We have the wrong one here. She has no human feeling at all, and she only comes here to further destroy you." However, we are not sure whether they also realized that Herman's mother had a narcissistic personality disorder, but they clearly knew there was something wrong with her, but did not ring the bell at Child Protection Services, so 2 children were left at the mercy of a narcissistic mother. Anyway, she wasn't their patient and they didn't want trouble with their superiors about remote diagnosing, so they kept silence about it, with all the consequences for the children. Diagnosing narcissistic personality disorder by a layperson. Knowing that remote diagnosis by a psychiatrist is taboo, it should be clear that diagnosing narcissism by a layperson is completely taboo. That makes it very difficult for victims to gain recognition. The abuse will not voluntarily be diagnosed, and without diagnosing narcissism by a licensed physician, the person doesn't formally have a narcissistic personality disorder. When a victim of narcissistic abuse reports to a support agency, there is a good chance that it will be told that they are not allowed to diagnose someone as a layperson. The perpetrator therefore remains out of the picture and the real cause is not treated. This means that the victim becomes a victim again, which is called secondary victimization. Secondary victimization means that the victim is confronted with incomprehension and dismissive social reactions and thus becomes a victim of the same offense twice. Most people who have discovered they are a target of narcissistic abuse have already read about narcissism before they label someone else. This usually concerns someone with whom they have lived together and have experienced the ugly side the narcissistic hides for the outside world. However, the outside world only receives the perfect picture the narcissist creates of himself, so they can't imagine how that person really is. In addition, most people are unfamiliar with narcissistic personality disorder and assume normal human interactions. So in a conflict, they will think that both parties are to blame. Be careful calling someone a narcissist. Unfortunately, it also happens that targets of narcissistic abuse become so obsessive about the subject that they think they see narcissists everywhere. Watch out for that. Knowledge is good, but it should not become an obsession. When you label someone a narcissist too easily, no one will believe you anymore. So even if it really is a narcissist, people will soon say, in your eyes, everyone is a narcissist. Remember, not everyone who bothers you is a narcissist. There can always be another reason for its behavior. When you express your suspicion that someone is a narcissist, only do so with someone you have actually experienced firsthand. If you want to learn more about narcissism, narcissistic abuse, and the recovery process, then please subscribe to our channel. Click also on the bell icon for notifications so you don't miss our next video. Visit also our website. There you can download the free ebook 10 Tips for Recovery After Narcissistic Abuse. Thank you for watching, and I see you in our next video.